We envision a movement.
We envision a movement.
We envision a movement of God's people.
A movement of God's people.
God's people who choose daily.
Who choose daily to promote healing
in marginalized communities in the name of Jesus.
In the name of Jesus.
In the name of Jesus.
Well, Carol, thank you so much for taking your Sunday afternoon and coming to do Esperanza to tell your story.
Well, thank you. Thank you for the invitation.
Yeah, I was sharing with you that as I've talked with so many people around about the first early days of CCHF, and I've asked them who should be on this list of people that we talk to, everyone mentions your name. So I'm really eager to hear how you got involved with CCHF. What was your involvement with CCHF at the very beginning?
I actually was trying to reminisce when I agreed to do this, to think about how I actually first learned about CCHF. And I was probably, it had to be, I was either a late junior, early senior at Wheaton College, where I was majoring in pre-med.
Mm-hmm.
And I don't remember whether it was a radio program or a TV program, but I heard a clarion call from John Perkins about this organization that was beginning, and he was calling forth healthcare professionals to join him in working with addressing the needs of the disadvantaged and poor people.
Yeah.
And so I don't remember where and how I actually heard that call, but I remember clearly how much it pierced me. One, because it, even as I was just at the very beginning of pursuing what I thought at that time was going to be a medical career, working with the disadvantaged and certainly my own people, African Americans, was at the top of my heart and list. And so to hear this, and I didn't know John Perkins then.
Oh, really?
So that's it. For me, it's all divine.
Yeah.
In terms of how things come together. And so, whatever the sign up mechanism was, I did very early on, and then maintained my connection with CCHF from that time.
Right.
That time on.
And I know you served on the board at least once.
I did twice. I had two terms. Yes. Yeah. I actually, after my master's degree at Western Illinois University, I actually came back here to Philadelphia and worked for 3 years here, right up the street. Well, not up the street. Thinking of Temple, right up the street from at Broad and Lombard for one of the city health departments. And it was during that time that I got to attend my very first CCHF conference.
Yeah, that
was here in Philly.
Oh, okay.
And that's where I met all of the key players, HSPs, Dr. John, Carolyn Klaus.
Yeah. And
actually it's from there that I connected with her to begin what she at that time called HEAL workshops that served as the basis for the beginnings of Esperanza.
Yeah.
And we went around did health education, health information sessions in people's homes.
This probably would have been around 83, 84.
84, like it would have been it was between 84 and 87, which was the time that I was here.
Yeah.
And was mesmerized with the organization, the people, the mission and the call.
Yeah.
And the thing that I credit CCHF the most for in terms of my own life and career was solidifying and helping me to retain that mission and that focus. You know, when you get into school and start looking at all different things and where you could possibly be, being connected to CCHF helped me to retain the mission that I had and that I developed for serving and working among the marginalized groups.
Wow.
And so attending the conferences, I pretty much attended conferences every year. Eventually became one of the speakers for the conference and did some writing for H&D, and was invited to serve on the board. And so I had 2 terms on the board. So it was an ongoing support for me personally and professionally,
Yeah.
being involved with the organization.
Yeah. It sounds to me like it might be time for you to be another speaker and do another workshop. I mean, at this,
at one
at this,
point I was doing it pretty much every conference. So
Yeah.
yeah.
well, this would be a good year for you.
Oh.
So it sounds like even before you heard about CCHF or met John Perkins, that you had a sense of God calling, or what made you want to be a doctor? Why did you choose pre-med when you went to Wheaton?
Well, since when I always loved science, and in 10th grade I did my first dissection and just
Yeah.
fell in love with all of that, all that part of science, and but just felt very early on, even as a young person, that the healthcare arena, and at that time, way back then, they didn't have courses that expose you to the breadth and depth of the healthcare field.
Right.
So if you wanted to go into healthcare, most of us, we thought the only thing we could do was to be a doctor or nurse.
Mm-hmm.
And so that's what I wanted to pursue, and did in fact go to Wheaton for pre-med. Interestingly enough, around the same time that I heard this clarion call from Dr. Perkins, I also stumbled across the whole public health and health education field.
Mm-hmm.
And again, just like with CCHF, I don't know how that occurred. I don't remember how I stumbled across this field called public health and health education specifically. But the more I read about it, the more it fit the picture that I had in my head of what I was going to be doing as a physician. I never saw myself in a white coat,
Yeah.
in a hospital, working with patients, so to speak. I always saw myself out in the community, working with groups of patients, doing more teaching than treating patients. And I say it's divine, because I didn't know anyone in the field or any, physicians or health educators that was doing that. And so the more I read about the field, the more I said, this sounds more like something of what I would want to do. So I graduated pre-med, and much to my father's great dismay, I went straight into a community health education master's program, and have been there ever since.
Yeah.
And it really became the platform through which I did the work of working with various population groups,
Yeah.
and in need for healthcare. So the picture for me came fully around of meshing this vision that I saw, that I didn't know where it came from, with the passion that I had for working with groups of people and people in need. And the other part of what CCHF did was, both through my master's and doctoral programs, helped to guide even all of my coursework, and all of my papers and my thesis, my dissertation was all centered around serving the needs of marginalized populations.
And so you ended up in Philadelphia for a few years, working with Carolyn.
Yes. Well, yes. And working with her in what she called the HEAL workshops, which are just, and when I think about it, she really was ahead of her time, in terms of it's now considered a standard practice method of doing workshops exactly where people are located, whether it's the home, church, community, or whatever. And so that was really a great advancement I think that she made in terms of establishing that as a model. And I think that she and along with David Hilton was also involved at that time. I actually did some work with him as well through CCHF and working with the whole empowerment model and assets model of working with communities, not on them.
Mm-hmm.
And I think that if there is a contribution that I made to CCHF, I think helping to expand that concept beyond just the medical model of working on disease from a individual perspective,
Mm-hmm.
but really looking at these various health issues and conditions that communities face from this broader population perspective.
Yeah.
And from the perspective of the people themselves, and not making so many of the assumptions that we make about people who are poor, people who are disadvantaged, people who are unhealthy, that, they don't want to be that way.
Right.
And so our approach is how we get to help them answer the question, do you want to be well? Is a huge factor, I think, in how we go about our work.
I'd love to hear you talk a little bit about how to get to that point with people who live in the communities that God's called us to.
Yeah. I think we first start with just simply with where they are. We make and have made all kinds of assumptions about people in general. We make assumptions about people in general, which is
they're usually
always
wrong.
hard. Yes, yes. And so I think we basically just start with where they are, and asking very basic and simple questions. For me, one of my favorite healing story is the man at the pool of Bethesda.
Yes.
And he goes through all of his reasons why he's still sitting there after 38 years.
Mm-hmm.
And Jesus asked him that simple question, do you want to be well?
Yeah. And
somehow, even after being there for 38 years, by that simple question and command from Jesus, he gets up.
Yeah.
And so I think we start where people are. We listen to their issues. So Jesus didn't say, shut up, so to speak, on all of these excuses. You have all of these excuses on why you're still sitting here 38 years. But I think we don't ask people enough about not only do you want to be well, but what can we do? How can we help you? How can we assist in that wellness process? So I think we asked some basic questions. Paulo Freire was one of my, actually went to the doctoral program to study his work from the pedagogy of the oppressed, which is the basis of his work is the basis of our adult education, learning and the whole empowerment model. And he suggests that when we go into these communities of need, we shouldn't go in thinking about what we're going to do to change them, what we're going to do to fix them. That we first need to just listen to people. And if we listen long enough, we'll hear people's hearts and what needs to be done to address their issues. The other thing he says is that people already know what their problems are. Right. They don't need us to come in and study, all these studies that we do to identify all these things, which studies are certainly important. But people already know what their issues are. And if we listen long enough, they actually also have the solutions for addressing their issues. Yeah. Because they've lived with them much longer, obviously, than we have. And so what our role then becomes is to assist in the process of finding those solutions, not coming in with the solution.
Yeah. some years ago, I went to a missions conference and was asked to speak, and we were talking about a lady that was a friend of mine who was morbidly obese, and she had neuropathy in her legs, and she was blind in one eye and going blind in the other, and all of these kinds of things. And I remember it was a mature doctor who actually said, the answers are simple for her. They've always been simple. It's diet and exercise. And for me to sit down and say, she lives in a neighborhood that you wouldn't let your mother go walk in, so she lives in a neighborhood where it's easier to buy drugs or a gun or a prostitute than a salad. And the answers are more complex.
Yes.
And the truth is, she has them. She knows what the answers are better than the well-educated guy who walks in. It's almost like what you've shared is almost like the first step needs to be that we have to overcome our own presumptions about the people that we want to help.
Exactly. Yeah.
So,
and we have many on various levels and on various things.
That's right. So when I first met you, you were working for the CDC in Atlanta. How long did you do that?
10 years, and that was enough. I knew when I went that I was not going to be one of there are folks that have been working for CDC for 20, 25, 30 years.
Yeah.
I knew I wasn't one of those people. But 10 years was quite an experience.
Yeah.
Yeah.
So kind of walk me through from Wheaton
to Western.
And then Western to Philadelphia.
Western to Philadelphia.
And
then I when I left Philadelphia to get my doctorate at UT Knoxville. And then from there took a teaching stint at Cleveland State University.
I did not know that.
Yeah. And as a matter of fact, just talked last night to one of my favorite students, former students from that university. Just last night, heard from her. And then from Cleveland to the great University of North Carolina at Chapel Hill, which is probably the worst job I've ever had. And it was just a difficult place to be. But the position was actually a dream position, because they were experimenting with UNC got one of the National Kellogg Foundation grants for community-based public health. And they funded 9 entities. It wasn't just university oriented, but the model, which has become common. This was in the early and mid 90s, that has now been established as a very solid model, was just beginning then of partnering universities directly with communities and health centers. And so you weren't even eligible for the grant if you didn't have that triad experience. And part of what UNC wanted to do was to appoint a faculty member 50% right in the community. And that was like an ideal situation. So I had a 50% appointment at the university and a 50% appointment directly in the Raleigh community. And that was actually, that part of it was wonderful. It was all the other stuff. And it's there that I got the title of Professor in the Hood.
Oh.
And the community, even, they couldn't believe that, in their words, that the university was letting me be with them in the community. They were so used to having faculty and their teams come and go,
right? Do
research, do a project, and then they're gone.
Yeah.
And so to be there for 8 years, that was quite an experience. And then left there to go to Southern Connecticut State University.
Okay.
And then it's from there that I went to CDC.
Okay.
So that was the cycle.
And then ended up at Temple.
And then at Temple, yeah.
Back home.
Which actually is truly a full circle. I actually I went to Temple for 1 semester and flunked out. I went straight out of high school.
Now you are a teacher.
Straight out of high school, and was not prepared, was
Yeah.
not ready. I actually I was ill a significant part of the latter part of my junior year and early senior year. So I had to do like a double load just to graduate on time.
Right.
So I wasn't prepared or ready at all. And so flunked out my first semester, my 1 semester at Temple, and then almost 30 years later
Yeah.
was back as a faculty member. So that was, yeah. So it's been
Yeah.
quite a little bit of a ride.
So your faith in Christ and the gospel
Mhm.
has been a kind of a driving force in your life for, as far as I
Mhm.
can tell, the whole of your life.
Yes.
And when did that begin? When did you begin to be a serious follower of Jesus?
I am from a strong Christian family,
Mm-hmm.
but my mother, who did quite a bit of work with youth and children in the community, as along with another woman on our block, Mrs. Phyllis Flint. Mrs. Flint would, my mother says, always told her, she had 9 children. There were 7 of us,
Mm-hmm.
and she always admonished my mom to ensure, so don't just assume because you're a Christian, you're doing all this Christian work, that your children are actually following. So you need to ensure
Yeah.
their salvation as well. And so I actually accepted Christ in Mrs. Flint's Bible club at the age of 7. And I remember it so distinctly because I went to her Bible club for the snacks. She had the best snacks, and so much so till when I started having my own Bible clubs, I always made sure I had great snacks
Yeah.
for the kids, and very, very colorful, extremely colorful. What did they call them back then? Felt
Oh, yeah,
felt
yeah,
boards
right.
with the. And so I remember that so clearly. And she would give the salvation message and invite us to receive Christ each time. And I went up every time. Every week I would go up. But I remember very distinctly the day when she was teaching about Christ's passion on the cross, and where I fully I understood what she was saying, and that was done for my behalf.
Yeah.
And I went up another time and never went up again
Yeah.
after that. And from there, obviously, as being a strong Christian church-going family, faith was nurtured obviously through Sunday school,
Yeah.
church school. My entire youth and childhood and youth, and very thankful. I used to say, people give their testimony about their salvation,
Mm-hmm.
and they talk about what God saved them from.
Right.
That I was an alcoholic, I was a drug addict, I was this, I was that. And I used to say I didn't have a good testimony because I didn't have any of that I was quote unquote saved from. And then I learned much later that I in fact did have a testimony, that I in fact was saved
Yeah.
from those things and not having
That's right.
experienced those things, and that I was blessed to have a consistent walk with God and walk with Christ all this time. It's one of my most powerful life experiences.
Yeah.
That I wouldn't trade for anything.
I think it's easy in the healthcare careers to get lost in the weeds, and to it sounds like that some of that happened with you with the CDC and maybe even at UNC. But how did you see the gospel applied or inform your career in public health? and in academia?
I think it informed it all along the way. First, from the perspective of the focus of the people with whom I worked, and the focus on the least of these, so to speak, and ensuring that the work that we were doing, the work that I was doing, was work that would honor the heart of God for those that he considered to be the least of these, and continuing to address those issues, or addressing those issues on a consistent basis. So for example, one of the great weeds at UNC as a great research institution, and it's really with most research universities, you get these grants for 3 to 5 years. You do the work or some work, and then you're gone from a neighborhood. And so I made a very strategic and I believe God-honoring decision that I was not going to pursue that route as a researcher and as a practitioner. That getting the grant to fulfill my portfolio and research agenda without the community having the equal benefit of not just the work, but the results of the work, was something I was simply not going to do. And so as a result, I missed out on a lot of the big grants, especially the large NIH grants, and the the R01s and all of that, because I just refused to enter that system and that process. And that was a conscious decision, and that I believe was God honoring.
Yeah, I think so too.
To enter that process,
to not think of these communities as a petri dish to study, but as a community to engage in those kinds of things. I think, a couple of things that really strike me as you share a little bit about what I think is also a biblical philosophy of empowerment, of listening, of helping people come to their own answers. I think having lived in a community like that in Memphis for many years, there are people who, if you ask them, do you want to get well? Their immediate answer, they might roll their eyes and say, well, of course, but the truth is they've lost hope.
Yes.
And I think hope is a missing component in the whole public health thing.
Oh, absolutely.
We replace hope with policy.
Absolutely. Part of our role, I think, is to help people to determine how to restore that hope.
Yes.
And the steps, and this is no magic bullet for any of this.
Yeah.
But helping them to walk through whatever the steps are that are needed to restore it, both within themselves and then within their larger community.
And I think there's a beautiful marriage of the gospel and policy that has to happen in order for that to happen. The gospel without policy is pie in the sky. The policy without the gospel is a plan without hope. And I think that, I don't know, does that make sense?
Oh, absolutely. Yes, absolutely.
Yeah. And
I think we you mentioned about the connection of and how the gospel and how faith in the marriage of all of this together. The other piece for me has been that I think is, especially from a health and healing perspective, is the various ways in which Jesus healed.
Yes.
And so we often tend to get locked into this one way of doing things, and even, considering some things the best way. I don't know if there's a best way. But Jesus used multiple methods, multiple methodologies in healing. and bringing people to their healing. And I think that's another way that the gospel of healthcare, so to speak,
Yeah.
and the health and healing is and should be expressed. That we're not just looking for a one-stop shop
Yeah.
method or efforts, but that it's a combination of methods and various ways in which healing can take place. And so that's part of the whole listening piece, to determine which methods, which strategies
Yeah.
are best for the various groups and people with whom.
Yeah. When you think about your time as professor in the hood, I love that title. I think that's
Yeah,
great. But
yeah.
when you think about your time there, is there a story or an example of something that you saw that you thought this is what it's about, and this is
Yeah.
something you're
Yeah, my one of the great outcomes from my terrible experience at UNC.
you had a great experience in the neighborhood.
In the neighborhood, and
Not
with the people,
not so much
not
on the
with
campus.
university, no.
Yeah.
But I was really blessed to develop as a part of this 50-50 arrangement. We actually developed an initiative called the Ministry of Health.
Mm-hmm.
And it was an initiative, an intervention design of the Carolina project focused on 4 different communities in the North Carolina area, in and around UNC, and Raleigh was one of them. But it was a great blessing because it was a vision that I had and that we were able to put forward. But it was an effort to work with local churches and lay congregants to become the health ministers and workers within their communities. I had read about, early in my master's program, and then in my doctoral program as well. At that time, in those years, let's say maybe the mid 80s, late 80s, this whole concept of utilizing churches, particularly among African Americans, and to some extent, not to the same extent, but to some extent with Latinx populations as well.
Mm-hmm.
But given the strong faith connection and spirituality connection that local churches could actually serve and be utilized as not just a place for health initiatives, but as an actual vehicle for them,
Mm-hmm.
given their position in the community. And so we were actually able to develop an initiative for the state of North Carolina, where we trained pastors and lay persons to become the health ministers
Yeah.
for not just for their local churches, but also how to reach out to and expand to their communities. And that model is actually still going on with some of the health educators at the Wake County Health Department in Raleigh, all these many years.
Wow, that's great.
Later. And we were considered at that time as being on the cutting edge of doing that level of work. And also what had been missing from some of those faith-based initiatives was the actual use of the scriptures, the gospel, again, as a component of the outreach and the intervention. And so that was very much considered cutting edge then, which is now, if you look at the faith-based literature now, it's almost a common thing, but it wasn't then. And so that is something that I really cherish.
That's awesome.
Mm-hmm.
15 years ago, it was rare for academic institutions, especially medical schools, to really talk much about faith
Mhm.
in conjunction with health. And
Mhm.
now there's quite a few
Very
very
much so, yeah.
prestigious medical schools who have
Yeah.
departments
Yes.
of faith.
Yes.
And in terms of, you've got to be encouraged uh, at the amplification of the issues of social determinants of
Mhm.
health and the
Oh, yes.
realities that uh, your zip code has more to do with
Mhm.
how long you're expected to live than almost
Absolutely.
anything else.
Absolutely, yeah.
And
Huge leaps in that area in the last many years.
yeah,
Mhm.
well, thank you for being
Mhm.
part of the foundations of that coming to light. I think that's
Yeah.
wonderful.
Yeah.
What would you say to? We're going to have people who listen to this podcast and or watch this podcast who are thinking about careers in public health and who have a real deep passion to serve Christ and want to do it as an expression of, as a platform for, and as an expression of the kingdom of God.
Mhm.
Um, uh, they're gonna come up against an entire institution that is rich in resources and rich in opportunities and provides at least as many hindrances as they have opportunities. What would you say to someone just starting out now?
Very, very true. So very true. And I think it's true. I actually think that's true for whatever discipline you are in. If and as you have a heart for doing the will of God
Hmm.
and expanding and serving the gospel. One of the first things I would tell them is to find a CCHF, and that's not just a add-on statement, because what as I said earlier, one of the things that CCH did for me particularly as a student was to help me to continue to stay close to the issues of this marriage of living out the gospel through your work.
Yeah.
The connections with the people, so the people of CCHF, not just the philosophical bent of the organization, but the actual people, and then seeing people and being involved with people and connected with people who are actually doing the work that you're hoping to do. So that would be the first thing, of connecting to CCHF or find a CCHF or CCMD, whoever, wherever you are, finding a Christian community or a community of people, a Christian organization or community of people that you can stay connected with, that can help you maintain the vision,
Right.
because it will get lost almost immediately
Yeah.
in the process and the classes and all the theories and everything. So that would be my first advice. Find a, even if it's not an organization, a community of like-minded people that you can stay connected with while you are being developed and while you're being trained, just to help you to maintain your vision and your passion.
Hmm.
And then the next thing I would recommend is to find and to maintain all of the ways that you yourself can maintain your passion.
Hmm.
And that may mean making your applications of your work, of your studies, to the specific areas that you want to, where you're hoping to work. Asking the serious questions. How does this, what does nursing look like from the gospel's perspective with this population? Write your paper to that effect. When I think back on my coursework, I think almost all of my papers and all of my projects were framed and written from that perspective. And so trying to make immediate applications while you're being trained on what this might look like from both a perspective of the populations and people and groups that you want to work with, as well as how it may mesh with the gospel.
Mm-hmm.
So I think it's a twofold thing. One, finding people that can support you, and then you yourself find whatever the various ways are to maintain your own passion.
Yeah.
And making critical applications while and then of course doing the right reading and study and investigation yourself.
Yeah. Were there any Christian sources that you felt like were helpful for you in terms of reading the right reading things?
Dan Fountain's book, and I'm not going to remember the name.
I can't remember it either, but
that was one of the very early books. Oh man, there actually about vision. 3 or 4. Say again.
Upholding the Vision.
Upholding the Vision, definitely. There are about 4 that I'm not remembering at the moment. I have to text you those.
Okay.
But there are 4. Dan's book. I don't know. Can't believe I'm not remembering the names.
That's okay. I'll tell you what we'll do. You send me your reading list, recommended reading list, and we'll put them at the bottom of the YouTube.
That would be great.
Yeah.
Yes, I will, because
there
are several.
Yeah.
That I think are foundational to one, helping you to both understand what this vision really is all about, and meshing the gospel of healing, meshing the gospel with healing ministry.
Yeah. Have you read Esau Macaulay's book, the new one that he's written recently? Wheaton guy, he's a professor at Wheaton, and he's written one called "How Much Further to the Promised Land," and it's really the story of his family. He grew up in Huntsville, Alabama, and it's not his story. It's not like you hear so many African American stories. It's a bootstrap story, but it is a very gritty account of the realities. How some people worked hard and didn't make it. Yes. How some people had it handed to them. How some people made big mistakes. All that kind of thing. It's a very, very it's a wonderful read, and I think it's we've for years have encouraged people to read John Perkins' Let Justice Roll Down, which is a great book. But I feel like Esau Macaulay's book is one of those maybe for this generation, because John's was written about his history, his time in the 70s and the early 80s, and this is about just that. Yeah. Anyway, I think we'll give a reading list. Yeah,
they're actually there are about 5. And I'll get that list.
All right, I'm counting. I'm going to hold you accountable to the 5. So, well, listen, you would be blessed to know that one of the things that we've seen in the CCHF primary care delivery world has been a move towards community health workers and a move towards addressing social determinants of health. And there's even in some states, progressive states, not the ones you have spent most of your time in,
exactly.
but there's reimbursements for some of those things to make that, because it is so much more impactful on the health outcomes of a community than frankly just having enough doctors there. Right. So we're seeing that, and we're seeing that expand more in CCHF. We have really wonderful emerging voices within CCHF around social determinants of health, and from public health perspectives, particularly from people like our board chair, who right now is Brianna Lathrop at Good Samaritan in Atlanta, and also from Janet Kim gets a shout out there from Beacon in Staten Island, and so these are rising voices, I think, to help us embrace more of that kind of thing, and we want to pick that up more at the conferences and make more space for those kind of folks.
That's terrific.
I think in the early days, J.D. Miller was telling me that in the early days of CCHF, that there were almost more public health people in the very beginning than there
Really? Oh, okay.
were physicians or medical students.
Oh, okay.
So,
Okay.
and you were one of those.
Okay.
So, yeah.
Yes.
Anyway, I think that's a welcome return.
Yes.
But
Yes, it is.
Is there anything else anything you want to say before we end this time?
No, it's just been a great time of remembrance, and I truly honor CCHF for not just for the work that it has done in assisting students and professionals, for working with marginalized communities, but also for what it does, and I mentioned this earlier, of assisting them in maintaining and implementing this great vision of the gospel of healthcare.
Yeah.
And I think CCHF is probably, there's some others, but I think it is still the premier organization that is doing that. And I think, there's some other entities that have a related message, but I really honor CCHF for the consistency over these many decades of both maintaining the vision and assisting us as healthcare providers, healthcare professionals, healthcare workers to maintain it within themselves. And that it's still so necessary.
We've had a really good foundation to build on. I've tried to be faithful to that foundation in these last, decade and a half that I've been leading CCHF. But I think the foundation is solid, and I appreciate that you have been a significant part of that. And thank you for your involvement.
Thank you so much.
Yep.
Appreciate it.